Welcome to this explainer. Today, we're going to translate the dense, highly technical SASB healthcare delivery standards into the human reality of patient-centric care. We're looking at the meticulous corporate accounting that goes into measuring the things that actually matter when you or a loved one walk through a hospital's doors.
It's a vital question, isn't it? Beyond the obvious metric of saving lives, how do healthcare entities actually track, measure, and disclose their social impact behind the scenes? When a hospital claims to be socially responsible, what data proves that? Well, today, we're diving into the specific sustainability disclosure topics that require hospitals to show their math on how they treat patients, protect electronic health records, provide access for low-income populations, and ensure top-notch quality of care. To get there, we'll hit 5 key areas: measuring patient-centric care, protecting your health data, expanding healthcare access, tracking quality of care, and finally, the future of transparency. Section 1. Measuring patient-centric care beyond the balance sheet. Our foundational framework here relies on the SASB standards, which are now under the stewardship of the IFRS Foundation. Now, these standards require entities to report on sustainability-related risks and opportunities that could realistically affect their cash flows or access to finance. But what we're really talking about here is human impact. We all know demand for healthcare is driven by demographics, illness, and injury rates, but the industry faces this massive regulatory pressure to reduce costs while simultaneously improving outcomes. This framework is essentially the blueprint for how a hospital proves it's actually doing both.
Section 2. Protecting your health data, the invisible perimeter.
So these standards demand a strict legal separation between your general personal data and your highly sensitive personal health data. Personal data might just be your name or address, basic information that identifies a living individual. But personal health data is a highly specialized subset. It reveals very specific information about your physical or mental health status and the actual medical care provided to you. Hospitals are absolutely required to describe their specific policies for securing this incredibly sensitive category of data.
And to do that, hospitals literally have to map out their entire information lifecycle. They have to disclose their practices at every single stage to protect your privacy. And this isn't just about slapping a password on a computer terminal. Entities have to detail exactly what data they collect without consent versus what requires an active opt-in. They have to explain how the data is used internally, under what exact circumstances it gets shared with third parties, how long they keep it, and critically, their disposal methods for both paper and electronic health records. It's a full cradle-to-grave accounting of your medical information. The crucial point here is how these entities actually implement that security. They must disclose 3 categories of safeguards, but let's just highlight the 2 most critical ones: administrative and technical. Administrative safeguards manage human behavior. These are the formal, documented policies that dictate staff conduct and training programs to prevent breaches. Technical safeguards, on the other hand, protect the digital systems themselves, things like authenticating users and controlling individual access. Oh, and they also have to implement physical safeguards to protect the actual brick-and-mortar buildings holding with servers. 0. Hopefully, that's the exact number of data breaches a hospital experiences. But if breaches do occur, hospitals are strictly required to report the quantity, and they can't just vaguely say, yeah, we had a breach. The standards require them to break down the percentage of breaches involving general personal data versus that highly sensitive personal health data. Furthermore, they have to report the total monetary losses resulting from any legal proceedings tied to data security, whether that's from civil actions, regulatory penalties, or even criminal judgments. The financial cost of failing to protect your data is tracked right here, down to the dollar. All right, Section 3. Expanding healthcare access, care for the vulnerable. Healthcare delivery entities have to transparently discuss their strategy to manage the mix of patient insurance status, primarily because this heavily impacts their ability to provide widespread care. Look, a hospital isn't just treating illnesses, it's balancing an incredibly complex financial ecosystem. They have to explain how they manage the risks and opportunities associated with patients who have private insurance, those on government-sponsored insurance, and crucially, those who are completely uninsured. To address those low-income and uninsured populations, hospitals utilize specific alternative pricing mechanisms. The standards ask hospitals to discuss these programs, clearly distinguishing between hospital-run financial assistance and jurisdiction-run indigent care programs. Financial assistance programs are typically administered by the hospitals themselves, providing no-cost or discounted care as a write-off for patients who simply can't pay. Indigent care programs, however, are usually administered by local jurisdictions to provide financial discounts. By tracking this, we get to see exactly how a hospital contributes to the social safety net of its community. Moving on to Section 4, tracking quality of care, the empirical reality.
the SASB standards actually mandate the tracking of serious reportable events. Now, this is a sobering list of largely preventable incidents that represent the invisible battle hospitals fight every single day to keep patients safe. We're talking about surgical events like operating on the wrong site, patient protection failures like someone wandering off or disappearing, care management events like medication errors, and environmental events like in-hospital falls or electric shocks. Hospitals must disclose the aggregate number of these events. It's a stark, necessary metric that forces real accountability for patient safety and satisfaction across all facilities.
When we look at how this data is structured, hospitals must report percentage incidence rates for hospital-acquired conditions. This means if a patient comes in for one issue and ends up acquiring a pressure ulcer, a healthcare-associated infection, or post-operative sepsis while admitted, well, the hospital has to track it. By calculating these incidence rates as a percentage of total patients admitted, quality of care becomes directly comparable across different facilities. It allows us to see, entirely based on empirical evidence, which facility is managing risk effectively and which one is struggling.
Quality is also measured by the number 30. Specifically, hospitals must disclose the number of unplanned patient readmissions that occur within exactly 30 days of a patient's discharge. If a patient is sent home and has to rush back to the hospital within a month due to an unresolved acute illness, a new complication, or just gaps in outpatient care, it heavily indicates a potential flaw in that initial treatment. Tracking this metric directly incentivizes hospitals to ensure patients are truly ready to go home and that they have the actual support they need once they get there.
And finally, Section 5, the future of transparency, a clearer picture.
So we've seen how these standards demand rigorous tracking of everything from the destruction of digital health records to the exact incidence rates of postoperative infections. This isn't just paperwork, it's the very architecture of accountability. I want to leave you with this provocative thought. As these standards pull back the curtain on hospital operations, making their social responsibility measurable and publicly comparable, how will this newfound transparency fundamentally change your next visit to the doctor? Will you start using this data to choose your care? Thank you so much for joining me for this explainer, and keep asking the tough questions.